To further mark the 50th anniversary of NHS inquiries, we here at the University of Birmingham have worked really closely with the Health Foundation in London and with the University of Manchester. And together we organised and ran a symposium in November 2018 where we brought together different people who've been involved in health inquiries with people who are writing papers for our series of articles that's going to come out in Political Quarterly later in 2019. And at this symposium we explored issues such as the different ways in which public inquiries are established and run, the different purposes which they seek to achieve, and we also came across a whole set of quite complex issues actually as we discussed health inquiries. And some of those issues included the fact that because there are multiple purposes for inquiries, perhaps that they can't always achieve all the things they intend to do. Secondly, that we have to be really careful in assuming that a public inquiry is going to offer catharsis to patients and families, because that may not in fact be the case. And also that it can be very complex to think that an inquiry is going to offer the necessary degree of accountability for the failures in care or services that have happened. Inquiries cost a huge amount in financial terms, in emotional terms, and also from an administrative perspective. What our symposium showed us last autumn was that we actually need much more careful and thorough research and analysis into the running and impact of inquiries in health. For at the moment, we, to some extent, lack evidence of whether or not inquiries really achieve the purpose that's intended, and critically, the effect that they have on patients, families, and indeed on NHS staff.